Probably the most commonly asked questions we're getting these days is, when do we go back to normal? If you want to find out, stay tuned. Hello ladies and gentlemen, my name is Reza Rutsari. I'm the Director of Undergraduate Education at the School of Dentistry, University of Manchester, and thanks a lot for joining me on another episode of Manchester Molars today. I think now that the teaching and learning is pretty much found its own routine and you guys are feeling a lot more clear and confident about your assessment, the next thing for you guys is, when do we go back to the normal? Now, that's a very difficult question for me to answer. I know you guys are very keen to find out when and how we go back. All I can tell you at this stage is that the Australian Dental Association last week published a document talking about how their dental professionals are going back and what procedures are allowed to do and what procedures they're not allowed to do, or they have to do it under very certain restrict conditions. The American Dental Association also only 2 days ago developed a document talking about returning back to work and how dental professionals can prepare themselves for seeing patients again with lots of strict measures in place. Now I'm sure the next country which is going to follow is going to be UK at some point. I don't know when yet. All we know at the moment is that our government and Prime Minister, the priority for them is to still get us through the peak of the infection before they can plan on how we are returning back. But what we all know for a fact is, returning back to the normal we used to know is not going to be possible unless there is a vaccine for this disease or there is a definite cure. So I thought for this episode we invite a very special guest to tell us a little bit about the research development in this field. So I'm very pleased to introduce Dr. Alex Horsley, Consultant and Medical Director in Manchester Clinical Research Facility, as well as a reader in Immunity, Infection and Respiratory Disease. Dr. Horsley at the moment has got quite a strong research interest in COVID infection, and he's part of a large team which is running quite a big trial on this infection nationally. So I'm very pleased that he agreed to join us on this episode of Manchester Molars and give us a little bit of update on where we are in terms of research in this field. So join me on this call to Dr. Horsley. Hello Dr. Horsley, how are you today?
I'm good, thank you, Reza.
So thank you very much, first of all, for agreeing to come and join us on Manchester Molars. Could I please start with a very, very simple question? Could you tell us a little bit about what's known about coronavirus at the moment?
Sure. So coronaviruses are a class of virus that are one of the winter cold viruses. So a lot of patients will catch coronaviruses normally. But this particular coronavirus is one that's arisen, we think probably in China, as a result of recombination of a standard coronavirus and then another virus as well. So no humans have immunity to this. One of the reasons two reasons really it's particularly problematic. The first, that there's a long period where patients don't seem to have symptoms but they can pass it on. And the second is that it does seem to have a very high rate of fatality, particularly in patients who are a bit older or who have other comorbidities. So it's able to spread through the population, and then it seems to have a late effect, maybe after the virus has been cleared, a couple of weeks after you catch it, where people become very unwell with what seems to be an exaggerated inflammatory response. And what we're not clear is exactly why that's happening, or indeed at this point exactly how to treat that.
That's right. So just on this, because you mentioned about patients who are more susceptible and vulnerable, because your clinical activities around patients with cystic fibrosis, so they are quite high-risk patients. So could you tell us how or what do you guys do to keep your patients safe?
So there are a number of high-risk patient groups. As I mentioned, obviously elderly patients, patients have other comorbidities, so heart disease, diabetes, obesity, but also patients with immune problems, so patients who are on chemotherapy, and in the case of the patients I look after, patients with chronic lung disease like cystic fibrosis. So cystic fibrosis, or CF, is a condition which is genetic. Patients are born with it, and it results in impaired mucus clearance in the lungs. The lungs get damaged over time. They get chronic infections, and they have, they can have over time. They get damage to the lungs, and they can become quite unwell. Now, the normal winter viruses can be quite damaging to some of these patients. And CF patients are one of the high-risk groups. So we have a specialist CF centre in Wythenshawe, and we've essentially shut that down at Wythenshawe. We've moved it out of Wythenshawe Hospital because it's a big respiratory centre with lots of coronavirus patients, and we don't want any of those groups to mix. So the centre's been relocated to the Spire Hospital in Manchester as a clean site. We're not having staff passing between the two sites. And we're not seeing our patients unless we really have to. So we're doing telephone conferences. When they come in, we're wearing masks ourselves. Obviously, we're getting the patients to wear masks, and we're minimising contact. And the advice to patients at home is to obviously keep going with all their treatments, to avoid going out. If they have people at home who are unwell, obviously then to shield themselves very effectively from that.
Thank you. And now I understand that you are very active in research. And I really wanted to know your opinion in terms of what's going on in terms of COVID research, and where do you think things are going at the moment?
So it's been a very interesting time, actually, as a clinical academic. So one of my roles is I'm director of our clinical research facility at Wythenshawe Hospital. So we do a lot of respiratory research anyway. And there were already trials that were ready to run, set up ready to run in expectation of the pandemic. So we're part of something called the Recovery Trial. It's a national study, and all patients that come in can be offered this. Not all patients choose to take part, and they get randomised to one of currently 5 different treatments, including standard of care, so not adding anything on, and then 4 different options to add treatments on. So nationally, that's recruited over 7,000 patients now, which has been a phenomenal achievement. And we would hope that at some point soon they'll be able to report that. The problem is the outcome is 28 days after recruitment. So although there's lots of patients in it, it'll be 28 days before we can get all the results. But also Wythenshawe, we're a major teaching hospital. We have other trials. So we have what's called a phase 2 trial. So that's an earlier phase where we're looking for safety and efficacy signals. We're looking to find early signals that treatments are effective. And we've got a trial of nebulized interferon. We've got other trials that are set up within ITU, and we've got other studies that are looking at capturing blood samples from patients so we can understand what's happening to them as they hopefully clear the virus, but also if they don't. So there's a huge research activity, and both the university and MFT have been very active in reassigning staff, repurposing the facilities and the equipment and the systems in order to recruit patients. And that's happened across the nation as well. So there is a lot of very coordinated activity going on, and the NHS here is a fantastic strength, because in many other countries there's a more fragmented healthcare system that doesn't allow this national effort to be delivered in quite the same way.
Totally agree. I think we're very lucky that we do have the NHS service on our side. Now, talking about the research you're just mentioning, and I understand you don't have the hard data and analyzed data in hand yet, but from your expert point of view, do you think we are potentially looking at a cure or treatment for this disease?
So I think we're probably in this for the long haul, I'm afraid. With some of these studies, what we're looking at using is drugs we already have in our clinical portfolio, which we think are going to be effective against the virus or against the exaggerated inflammatory response that the virus seems to trigger. So there are some of these drugs in trial at the moment, and I guess if a really strong signal came out at an early stage, then those drugs could be rapidly rolled out to large numbers of patients. And that's a best case scenario, and more likely, or more realistically perhaps, we're not going to find a really strong signal from just one of these drugs. It may be that time will allow us to decide which combination of drugs, or it'll be one of the newer drugs that are currently being tested that will inevitably take longer to go through the whole process. And that's with a very rapid process. So the systems that have been put in place are very rapid now, that these drugs get turned around for approval very quickly. But even allowing for that, we still need to put lots of patients in to know what the longer term effects are and quite how effective things are. So I don't think there'll be a drug that's found very, very quickly. I would hope over time we're going to start getting signals, and maybe either one or a combination of drugs will be effective. But I would be a very rash man who put a timeline on that at this point in time.
Okay, that's very helpful to know. And I'm sure lots of people have got this burning question about the vaccine and prevention. Where do you think the research is going in terms of vaccine at the moment?
So clearly, the thing that would help end this most rapidly would be an effective vaccine. We're not taking part in the vaccine research here in Manchester, the Oxford trials that have just been announced. But there is a lot of activity, both UK and internationally, looking at this. But I think, as has been in the public domain, we are looking really at a good 12 months before we have anything that will be delivered on any kind of scale. So, as I said, unfortunately, it does look like we are in this process or some form of lockdown, some form of restricted normality for the long haul.
Okay, thank you very much, Dr. Horsley. That's been very informative. I really appreciate that you set time aside to come and join us. It was very helpful. I would like to thank, on behalf of all the dentist students and my dentist colleagues, for your time. So enjoy the rest of your day.
Thank you very much.
Hopefully we'll see you later at some point. Thank you.
It's a pleasure.
Bye.
Thank you.
We are in months of Ramadan now, and lots of our Muslim student colleagues and staff are fasting. So I thought I'd give one of our students a call to see what is it about the month of Ramadan and ask her a few questions about fasting in general. So join me on a call to Zara, and let's see what Zara has got to tell us. Hi Zara, how are you today?
Hi Reza, I'm good, thank you. How are you?
I'm very well, thanks for asking. Now, Zara, so this is our first episode of Manchester Molars, which is within months of Ramadan. So thanks a lot for agreeing to come live and telling us a little bit about this month. So could I just start by asking you, what is it about the month of Ramadan which is so significant to Muslims?
So during Ramadan, we fast every day of the month. It's roughly in the UK about 16-17 hours, dawn until dusk. So that means no food, no water. We usually get asked, not even water? No water. But ironically, the sole focus isn't food and abstaining from food. The whole premise of the month is kind of like self-development, realigning your goals, how do I leave the planet in a better state than I found it, like that kind of whole philosophy, I guess. So it's kind of, you say back to the tongue, the eyes, the ears. So I don't have a problem with lying or bad language or anything. You try and cut it down. And I guess because like food and water is like a basic instinct, you kind of have more awareness when you're not eating and drinking. So you're kind of able to stop yourself a bit if you're gonna, swear or say something that's not that polite or whatever you might.
So am I correct to think it's all about self-development and self-control? So if you can control yourself and refrain from, for example, eating and drinking, which is probably the basics of that, then you're trying to become a better person by stopping yourself from doing lots of things which are not considered good. Is that correct?
Yeah, I guess. And then I guess there's also like the charity aspect and the giving, and a lot of the month is about trying to serve like your community and stuff.
Okay, very good. So just from your personal experience, how is it like when you fast? Because I assume in the UK it's very long hours. So how are you coping? How does it work?
Well, I mean, obviously it's very different this year. We're all, in lockdown, but usually you go to school or work or whatever and you're quite distracted. If it's in summer, you do get like a bit thirsty, especially if you're talking all day long or you've got, sport and stuff. Like a lot of people, I won't put out my sport and stuff during Ramadan. But I say the first kind of few days, your stomach's kind of like, oh, where's my lunch? But then you kind of get used to it and your body adjusts and you don't really get hungry.
Very good. Now I know lots of our obviously Muslim students and staff, they take this month as a month of celebration, and it's a big thing for obviously all the Muslims. And I assume this is because of all the self-development and the charity and doing all the good things. So from your personal experience fasting in the previous years, could you tell us a little bit how that helped you to develop?
It's kind of good for your mental well-being and stuff. You find that giving and trying to be charitable, it makes you feel better as a person. In a dental perspective, it's good for your teeth because you don't have the Stefan curve is right down there during the day. But yeah, I guess in a spiritual, emotional sense, just kind of have more gratitude. More gratefulness for basic necessities like food and water.
Okay, thank you very much, Zara. Thanks a lot for your time. and I hope the whole month of Ramadan goes really smoothly. I understand that you guys have a lot of exams also to get prepared for. So best of luck with that. Thanks a lot again for joining us, and enjoy the rest of your day.
Thanks, Reza.
Okay.
You too.
Bye-bye. Right, so today we had our restorative mock on-scene exam. Have a look.
If you were to take out that upper central, what happens to the soft tissue and hard tissue around that area once that tooth's gone?
It's all going to resorb, the soft tissue and the bone will resorb, so it's going to make, if you are considering an implant or something in that area, unless you manage that straight away with the idea that you want to go for something like an implant, it's going to make it more difficult in the future.
So you say if you're going to manage it right away, how are you going to manage it right away?
Okay, so this was just a taster. So Karine is going to email all our BDS Year 5 students with a link to be able to watch the full length of this video clip. So we are coming to the end of this episode of Manchester Molars. Until next Thursday, I have been Reza Rutsari. You've been amazing, and I'll see you all next week.